listener production.
Hey, Chris Spyrou with you. Welcome to The Briefing. Around 22 million of us see a GP a year, and while consultations might be getting longer and out-of-pocket visits more expensive, there's a whole system behind the scenes that's struggling to keep up.
We've had Medicare in Australia for over 40 years, and when it was first designed, the average consult for a GP was shorter. It did involve one condition, but now the average consult involves often 3 things, 4 things, up to 8 or 10 things that we're dealing with.
That deep dive into why you're spending more money and time at the GP and what leading doctors say will help is coming up in the second half of this episode. First, though, let's get into the headlines with Tara Cassidy. It's Wednesday, the 15th of October.
Hey Chris, and to you listening, federal police say they're working to have the Prime Minister's personal phone number removed from foreign databases after it was revealed his and Susan Lee's were published on a US-based site that anyone can trial for free. And it's not just their numbers. The site also claims to have the deets of millions of professionals from around the world, including ex-PMs Scott Morrison, Malcolm Turnbull and Tony Abbott, New South Wales and Victorian Premiers Chris Minns and Jacinta Allen, Independent Senators David Pocock and Jackie Lambie, as well as Donald Trump Jr., French President Emmanuel Macron and British PM Keir Starmer.
Yeah, and the revelation came to light earlier this week when former host of The Briefing, Jan Fran, and current host of The Weekend Briefing, Antoinette Lattouf, were tipped off about the site after Ant was contacted by someone claiming to have gotten her number from it. The pair, who run independent media outlet at Media, then thought to verify whether the numbers were actually accurate by giving the PM an opposition leader a buzz.
Hi, you've rung Anthony Albanese. If this is a personal call, leave a message. Have a good day.
Hi, Mr. Albanese. It's Jan Fran here. I found your number on the internet. I'm not sure it's supposed to be there, but call me back, I guess. What the f***?
Now, Deputy Prime Minister Richard Marles says the government's aware of the website and is working with authorities, with the PM's office saying they have known about it since last month, while a spokesperson for the opposition leader says they were only made aware of it after being contacted by the media. Now, the AFP says it's formally requested that the PM's number be taken down and that other agencies are working to kind of limit the fallout for other MPs. They're also warning the public not to use this site to contact anyone listed, reminding Aussies that it is illegal to use a carriage service to menace, harass or offend, and they'll take swift action against anyone who does.
Yeah, and I think the interesting thing here, Tara, is that this site is one of several that are available, and what they effectively do is they scrape the internet and compile a bunch of info about a person all in that one place. So things like your name, your number, your email address, etc., etc. However, what's not exactly known in this particular case is how this happened, whether the numbers were taken ethically or even legally from places they were allowed to, or whether they've dodged certain website security measures and taken details that should have otherwise remained private, because LinkedIn, for example, has come out to effectively deny that it could have come from them. Either way, this is a serious thing given the rise in political threats and violence overseas and thwarted attempts back home. This is probably an area we should be paying a little bit more closer attention to.
Police and Defence Force personnel have almost doubled their search zone for missing 4-year-old Gus Lamont after advice from survival specialists. The search on the family's remote sheep station in South Australia near Yunta resumed yesterday after being called off over a week ago. Now, while police are looking at all leads, Commissioner Grant Stevens says there's no evidence that a crime has taken place and authorities still believe that Gus wandered off.
There is nothing to suggest foul play. We're hopeful that we can find him and return him to his family.
And he also says that this decision to resume searching the property basically came after specialists said there were still some other possibilities for where Gus might have gone.
This is not based on new information. This is based on our search coordinator specialists, medical specialists and survivability specialists looking at every possibility, and this is us exhausting those possibilities.
The 4-year-old disappeared over 18 days ago, with the search area since increasing from 2 kilometres around the property to about 5. Police say members of the public calling in with mere opinions on the case has been extremely unhelpful, as well as AI-generated misinformation that's circulating on the internet, including a picture of Gus, an AI-generated picture of Gus being held by a man next to a car. They're now waiting on results from a recent thermal drone search. However, the commissioner says police aren't expecting anything significant to come from that footage.
A Supreme Court in the US has rejected the appeal of right-wing conspiracy theorist and broadcaster Alex Jones, who labelled one of the deadliest school shootings in US history a hoax. In 2021, a 20-year-old Connecticut man attended Sandy Hook Elementary School and shot 20 children and 6 staff members before taking his own life.
911, what's the location of the emergency?
Sandy Hook School. I think there's somebody shooting in here. Sandy Hook School.
Okay, what makes you think that?
Because somebody's got a gun. I saw a glimpse of somebody. They're running down the hallway.
Okay.
They're still running. They're still shooting.
After the shooting, Jones began peddling lies to his millions of followers, including that the massacre was staged, no one died, and that it was part of a government plot to take American guns. He was later sued by the families of the victims, but when taken to court, Jones argued he had the right to make such comments due to the US's free speech laws, and during his appeal, he labelled the outcome a financial death penalty.
Yeah, and look, during the court hearings, Jones did actually admit that the massacre was 100% real, and then in 2022, he was found liable and ordered to pay a record-breaking near $1.4 billion in damages. Jones then filed for bankruptcy protection, which resulted in his media company InfoWars being put up for auction to help pay those Sandy Hook families.
Satire news site The Onion attempted to purchase the site, which was rejected by a bankruptcy judge at the time. However, it'll soon be back up for sale and they'll be able to make another attempt. Jones is adamantly against The Onion taking over InfoWars, claiming that would cause him and his 30 million strong audience irreparable harm, and he's yet to make any payment of damages. During the appeal, the US judge rejected Jones's claims, which the Sandy Hook families described as a desperate attempt to avoid accountability for the harm that he caused.
Yeah, and Chris, this is one really clear example for me, this and the case of Candace Owens versus the Macrons lawsuit, where I am really grateful that Australia does not have similar supposed free speech laws to the US, which are much weaker than what we've got here. And we have hate speech inclusions and stronger defamation restrictions, because I just really don't think people with enormous platforms and sway, they shouldn't be allowed to just go online and spew lies to millions of people that does cause immense harm to, in this example, already grieving, traumatised families. So I'm glad he's been dragged over the coals for this.
Instagram is now restricting what videos, photos and DMs teens can see on the platform, with users aged 13 to 18 being limited to PG-13 style content from today. Its parent company Meta made the announcement yesterday, insisting it's not linked to Australia's world first social media ban for under 16s that kicks in December. Rather, it's part of a global plan, with the changes to be rolled out in the US, UK, Canada and Australia first, before being fully rolled out by the end of the year.
Yeah, and those changes will basically limit violent or adult content for those accounts. It'll block searches for things like alcohol or violence, and also stop teens from following accounts linked to sites like OnlyFans. Now, Meta's also tweaking its AI to avoid inappropriate chats after backlash over reports that it allowed romantic or, quote, sensual conversations with teens. Now, as you mentioned, Chris, we are just 2 months out from our own social media ban kicking in, and we do know this week Google is still trying to get an exemption for YouTube. YouTube Kids isn't part of the ban, but normal YouTube currently is, with these tech giants saying that it'll push kids into more dangerous alternatives and could also block future stars from emerging, pointing to artists like Troye Sivan as an example.
Yeah, and I mean, we've talked about how this is a real balancing act between commercial interest and child safety, and kind of how the eSafety Commission and eSafety Commissioner is trying to get that balance right. Look, at the moment, we don't have a full list of what platforms will be a part of this ban just yet. We do know this week there are calls that are ramping up for Roblox to be included after reports of children being exposed to child sex abuse material and extremist content there on that game. But the eSafety Commissioner this week said that could be really, really tricky, because it's a video game and might not meet the strict definition of a platform whose sole or significant purpose is social interaction, which is the scope of the ban. So very, very interesting to see what's going to unfold ahead of that December ban kicking in.
Well, use it or lose it. That is the message from the government, who've told public transport riders in New South Wales that they're going to swipe the balance of any unused Opal cards. Chris, get using your Opal card. And for those outside New South Wales, those are the cards you use to tap on and off of transport. Now, the state government says any cards that haven't been used since the pandemic, so 5 years ago, that aren't registered will have their balances taken, which will give the government a lovely once-off sugar hit of $70 million.
Yeah, Transport New South Wales reckons there's around 17 million people with cards who have money on them that aren't registered, so they can't track their owners down. And that translates to around $4 per person of those unused balances there. Woo! Highway robbery. But look, they say their reason for doing this is because most of the cards belong to interstate and overseas travellers who are probably here for a short amount of time and have left money on their Opal cards. And they will be using the money to go towards new things like bike lockers.
Oh, wow. So significant and important. I hate this. I personally am one of those people who would use their Go card in Queensland. It's called a Go card once every few years. And if I have $15 left on that thing in 4 years, if I decide to use it, it better bloody be there. Do not touch my money.
Yeah, I saw this morning and I started having a look around my drawers and I was like, wait, where are all my old Opal cards? Because I reckon, I've got a whole week of trips left in there.
It stacks up.
Yeah, it really does. And look, we want to know your thoughts on this, how you feel about it. We're going to pop a prompt up on our broadcast channel, on our Instagram at The Briefing Podcast. Have a look out for that. And that is it for our headlines for today. Coming up next is my deep dive into why you're paying more and waiting longer to see a GP and what leading doctors are calling for the government to do to fix it. Stick around, that deep dive is coming up for you next. When was the last time you visited a GP? What did you go for and how much did you have to spend? Well, according to new research, you most likely delayed your visit due to cost, went for mental health reasons, weren't fully bulk billed, and paid about 10% more than you would have 2 years ago. And now that GPs across Australia are spending more time with patients than ever before, it's not just us who are bearing the brunt of it, with an overwhelming amount of practitioners reporting burnout as well as concerning levels of racism. Those are some of the key findings of the Royal Australian College of GPs 2025 Health of the Nation report, and it paints a picture of a health system that, while functional, is being stretched to its limits. So what exactly is putting pressure on our health system? Are the government's election promises stacking up? And what changes are leading experts calling for? Dr Michael Wright is the president of the Royal Australian College of GPs and he joins me now. Michael, welcome to The Briefing. What are the main things Australian GPs are currently struggling with?
We've just released a survey which has been asking our GPs what are the things that we're treating, what are the health conditions that our patients are presenting with, and what are the challenges that we're seeing in the system. And I suppose there are some good things. GPs are seeing more patients than ever. Nearly 90% of Australians saw a GP in the last year. But we're actually seeing more complex care. So as our population gets older, more people are living with chronic health conditions like asthma or diabetes, heart disease, and we're also seeing a lot more mental health conditions. So that's like anxiety or depression, and that's something which increased during the COVID pandemic, but actually has stayed elevated since the pandemic. And what we're seeing is that many GP consultations often involve multiple things. So it's not just a simple script or a referral or even a cough or a cold. It's often multiple things that people are presenting with. And I think not surprisingly, what we found in this survey is that consultations are getting longer. So the average consultation with a GP is just under 20 minutes. And for patients who seeing female GPs are actually spending longer than 20 minutes on average with patients.
So given this complex environment that we're kind of finding ourselves in with Australia's ageing population and the rise of mental health related health problems, how are we seeing that impact patients and the level of care that patients are receiving day to day?
The good news is that in the survey from government data, they've asked patients when you needed to see a GP, could you see a GP? So, were you able to find one? And 99% of people said yes, they could. But what we're seeing is that increasingly people are saying, look, I couldn't see my preferred GP, or I had to wait a bit longer than I thought, or I had to pay for it. And so access is still really good, but there are some challenges there. Some of that is around funding. So particularly we know with Medicare, it doesn't fund longer consultations as well as the short consultations. And that's one thing we've been pointing out for a long time, trying to get government to remove that disparity, because we want people who need more time with their GP to be able to spend that time without facing bigger out-of-pocket costs. And we also want to make sure that the GPs who are providing that care, who are more often female GPs, are actually properly remunerated for doing it, because it's complex and it's hard.
And are those changes related to what the report has labelled outdated funding models? Are those the sort of funding models that you guys are trying to have a crack at fixing here?
We've had Medicare in Australia for over 40 years. And when it was first designed, I think the average consult for a GP was shorter. It did involve one condition. But now the average consult involves often 3 things, 4 things, up to 8 or 10 things that we're dealing with. That's great that people can come and see their GP with the whole range of comprehensive conditions they need. GPs are up to treating it all, but we just need more time and need to be properly remunerated for spending that time, and Medicare doesn't recognise that. One of the other bits is, for most of the care that we provide in the practice, only, the GP time is paid, but it's only the time sitting in front of the patient. But the time that other people have, whether it's following up on results, whether it's doing referrals, that isn't remunerated. And it also means that if we involve other people in care, that doesn't get paid either. So one of the things we're trying to do is grow this idea of multidisciplinary care teams. Or if you may be in an area that had lots of mental health conditions, we might have a mental health worker or a psychologist who could give you some, almost like some briefer care, but you could get that from someone at your practice. So that's kind of the other model we're looking at, trying to, I suppose, grow the capacity of general practice to meet these increasing needs.
How does that fit in with the current long-term trend that, full bulk billing is on the decline and it's continuing to decline?
We've had freezes of Medicare rebates for most of the last decade. And what's happened is costs have gone up quicker than the Medicare rebates. And that's made it harder and harder for practices and GPs to bulk bill. And you can see in this data, I think it's around 15% of practices now can afford to bulk bill everyone. And so increasingly, in order to keep their doors open, practices are having to introduce some out-of-pocket costs. And look, and that's a message that's gone through the government. The government is making some increased investment in Medicare coming in November 1. And so that investment's welcome and well overdue. And we're really just trying to make sure that that funding gets to the people who need it most.
So that's relating there to the government's key election promise of boosting bulk billing. That comes into effect, like you mentioned, next month. Another key health promise that the Albanese government took to the election and won the election on was this idea of expanding Medicare urgent care clinics. Now, I know that also popped up in the report. What can you tell us about how GPs are feeling about expanding those clinics?
Most of what happens in urgent care is what we provide in general practice. People come in with a minor injury, people who come in with a condition they're not quite sure about, people who come with an infection. They're all things that we do in a general practice. And so most GPs would say, we'd just be happy to provide that in our normal practice. The urgent care centres are sort of a separate entity that are providing that care. And it's really important that they communicate back to the general practice so that we know that our patients have been seen. We know what the other facility has offered so that we can pick up the pieces and continue with the patient. But that applies to anyone who sees our patients, in the community. That's one of the things I'd say to your listeners. It's really important to tell whoever you see to say, look, can you please send some information back to my regular GP so that they know that we've been here? And as a GP, I always want that information. I've never gone, I wish they hadn't have sent me this. I do. I always want to know when patients who I regularly see are going somewhere else so that we know, is it something that we need to follow up on, or is that something that, we could have offered in our own practice?
And that kind of brings us to the conversation that we've been having this week, where the federal government's being lobbied by doctors and pharmacists to crack down on telehealth and online prescription providers. What can you tell us about those efforts and why there's increased calls for further guidelines and further regulations in this space?
Yeah, so look, from a GP perspective, telehealth has been a great addition. So obviously it came in COVID. for me to be able to talk to people who I know via video or over the phone for follow-up, for conditions that I know about, it's been a great, it's well overdue that we really should have had that years ago. So we do have it, and that's great. But I think the challenge is there are people providing that telehealth service who don't have access to people's history, who don't know people. And there's real dangers there of, if they don't know you or know what medications you're on or know your past history, I think they're less likely to be able to provide you with the right treatment.
What do you make of the way that telehealth is currently being used in Australia to deliver same-day scripts for things like medicinal cannabis or weight loss drugs like Ozempic or Mounjaro?
Yeah, I think there are real dangers there, as I think people, if you do need those medications, particularly, say like medicinal cannabis, it is not a first-line drug. So people shouldn't be prescribed that as a first-line medication. That and the weight loss aid, they all have interactions. They can have complications, and all of those treatments are best given in the environment of someone who knows you. Ideally, someone who has access to your record, who understands you and your situation, and not something that just focuses on script writing, for want of a better word. As a GP, I kind of think of a whole person, their physical health, their mental health, even their social setting are all things that we consider when prescribing medications. And I think that's the safest and best way to prescribe that. And I get it, some of this, these other routes to access, it's attractive and it's easy, but it's probably not providing the same level of care that people need.
Another thing that came out in the report is this finding around racism, that nearly 1 in 5 GPs have experienced racism from a patient and 1 in 10 report receiving it from a colleague. What can you tell us about those findings and why they were included this time in the report? Yeah,
look, this was something that we looked at for the first time because we hear anecdotal evidence, but we haven't actually tried to quantify, how common is racism in the health system and in general practice. Particularly for us, like as GPs, we see everyone in the community. So we see people from all cultural backgrounds, and the majority of GPs actually did their medical degree overseas. So also it's a really diverse group of general practitioners more than any other medical profession. So we thought it was really important to understand how common racism is for our patients as well as for our GPs. So really the reason for doing it was just to try and understand how common it is. And as you pointed out, nearly 1 in 5 GPs said they'd experienced racism. Nearly 1 in 3 said they've experienced racism, seen racism to patients in the health system. And so it's there. I think it's something we need to call out. And what we're really asking for the government is to support better tools to understand how common it is so we can put in place strategies to stamp it out.
Michael Wright, thanks for joining us on The Briefing.
Thanks so much. Thanks for your time.
That was Dr Michael Wright, President of the Royal Australian College of GPs. And that is it for this episode of The Briefing. If you found it interesting or you enjoyed it, why not flick it over to a mate? And while you're there, leave us a rate and a review. I'm Spyrou. I'll catch you next time.